Hi, my name is Tara Bear, and the title of my presentation is Does More Education Equate to Improved Quality of Care? A look at the relationship between the amount of education held by the nurse and the quality of care. So by the end of this presentation, the learner will be able to explore the historical pathways of nursing education, identify how having a higher level of education is relevant to today's nursing workforce, and to discuss the healthcare and societal impacts of having a bachelor's degree in nursing. I first would like to take a look at the history of nurse education, starting with the diploma pathway, which was established in 1873. The Bellevue Hospital Training School for Nurses in New York was established as a Nightingale Model School, and the vision for the nursing students was to provide care for the hospitalized patients at the Bellevue Hospital, to receive training to care for the sick in their private homes, and to work among the poor. During this time, hospitals were run by physicians, and students were required to staff the wards, and they did not get paid for that. Once they graduated, they went on to private duty nursing, where they earned a salary. Since the physicians determined the nurse's role and scope of practice both in the hospital and private duty, untrained nurses were utilized, which led to competition with trained nurses for those paid private duty positions. This, as you can imagine, posed a challenge. This led to the creation of the dual diploma Bachelor of Science pathway, which was established in the early 1900s. The intent was to provide the nurse with a broader, liberal study education and to develop more successful nurse-patient relationships and to effectively organize, teach, and work with individuals and groups in the community. During this time, nurse leaders started focusing on the minimum educational standards. So those that were in the dual diploma BS programs received the same type and level of training that the nurses that were trained in the hospital-based diploma programs were receiving. Again, this posed a challenge, so the associate's degree pathway was created in 1952, and this was created to differentiate between the technical and professional entry-level RN roles. The associate's degree nurse would be more educated than the untrained nurse, and also the diploma nurse from the hospital-based program. They would qualify to test for the RN license and would enter the practice as a technical nurse. The problem was that the hospitals at this time defined the role and the functions of the RN based on your license, not your educational. Next, I'd like to look at the article that the Institute of Medicine published in 2011 titled The Future of Nursing, Focus on Education. This article talked about the importance of nurses obtaining higher levels of education, and it did call for an increase of the number of nurses who held a BSN to be 80% by the year 2020. So why is this relevant to us today as nurses? Well, many of us are in this program because our employer is requiring us to. We know how demanding it is to be a nurse, and patients that we are seeing are much more complex and sicker than they were years ago. Also, patient safety can be improved by having more RNs with higher levels of education, which we'll look at a little bit later in the presentation. And lastly, as nurses, we work with a diverse healthcare team. Social workers, PT, OT, doctors, speech therapists, many of which have at least a bachelor's degree, if not more. So it would make sense for nursing to have the same level of education. So there are certain policy initiatives that are underway that are influencing and supporting nurses obtaining higher levels of education. BSN in 10 is one of them. States such as New York have already passed legislation requiring RNs to obtain their BSN within 10 years of initial licensure. As I had talked about earlier, the Institute of Medicine talked about the recommendation to increase the number of RNs with their BSN to 80% by the year 2020. The American Association of College of Nursing published an article, The Impact of Education on Nursing Practice, which talks about studies that indicated patients have better outcomes when they are cared for by BSN-prepared RNs, and that those RNs have better communication and leadership skills. Lastly, the American Nurses Credentialing Center Magnet Recognition Program has a big influence on this issue, since they require those hospitals who hope to obtain magnet status to show proof of their plans and to increase their BSN workforce. So how does this impact healthcare? Well, probably one of the most important would be the improvement in patient outcomes. A study that was conducted by Belgium looked at patient outcomes other than mortality rates, and it did find that the hospitals with higher proportions of BSN prepared nurses had lower rates of hospital-acquired pressure ulcers, post-op DVT, PE rates, they had decreased length of stays, and lower rates of CHF mortality. The next study looked at rates of patient mortality among surgical patients. They looked at a sample of patients from 1999 and then from 2006, and both patient samples showed a marked decrease in the 30-day mortality rate as well as the rate of patients who developed complications when cared for by BSN prepared nurses. So then what would be the societal impact? Well, there would be economic savings both to institutions and third parties. A study found that by increasing the BSN workforce to 80%, hospitals could save about $5.6 million annually due to the decreased readmissions and shorter length of stays. Also, there would be an increased salary for the BSN prepared nurses, and that same study determined that the money that would be saved would more than offset the cost of the increased salaries for those RNs who were BSN prepared. So in conclusion, as nurses, it is our duty to provide quality care to every patient, and in order to continue to do this, it requires us to further our education so that we can keep up with the rapidly changing healthcare system. By obtaining higher levels of education, it is beneficial to not only the patient, but to the nurse, and this is evident through the improvement in patient outcomes. Thank you.